Depression would be bad enough if it just did those things. However, what makes it serious is it increases the risk of stroke by 50%, increases the risk of sudden heart attack sudden cardiac death after a heart attack by 2.5 times. Actually, how long you survive a heart attack is more related to your mental health after the heart attack than it is what cardiac meds you're on. Increases the risk of heart disease in men. It increases the risk of death from cancer in both sexes. Increases the risk of death from pneumonia, which is still in the top 5 causes of death in this country. And it also increases the risk of suicide. And suicide is still in the top 10 causes of death. Suicide is the 8th leading cause of death. And actually, it's twice as common as murder in our country. And we have all of these murder prevention programs out there and a lot of money being thrown at that for good reason, but we really need to be considering something that's twice as common, and that is suicide. And it's actually the 3rd leading cause of death in people ages 10 to 24 in our country. And again, it just emphasizes the need to get at the root cause of those thoughts, those suicidal thoughts. And by the way, suicidal thoughts are often impulsive thoughts. A lot of people don't recognize this. Chronic suicidality is really not an acute state, per se. And this was, I don't know how many of you saw that study after they did their infamous, you wouldn't really call it a celebration, but a marking of the 1,000th person who had committed suicide off of the Golden Gate Bridge. 20 people had survived the jump, and some astute psychologists interviewed the 20 individuals who had survived the jump. They happened to land just right. They ended up in the hospital. They ended up with broken bones and collapsed vertebrae, et cetera, from the jump. And the psychologist said, "Do you wish you would have been successful in trying to commit suicide?" What do you think they answered? Yeah, they said, "No, I'm glad that I was not successful." Okay, and so he wanted to do a follow-up. "So you realize that you made a mistake?" "Yes, definitely made a mistake." "Okay, when did you first realize that you had made a mistake?" Two-thirds of them said, "As soon as my feet had left the bridge." And so suicide is often an impulsive act, and it's one of the things that we need to weigh against this is why the SSRIs are somewhat controversial, the selective serotonin reuptake inhibitors, because before they improve depression, they increase impulsivity. And so that's one of the reasons why even our own FDA has stated that we must weigh the risk of increased suicidality, particularly the first month that it's being utilized. And that's why we also need to make sure that we're training these individuals. In fact, I think it ought to be mandatory in every high school in America. We ought to have mandatory courses on emotional intelligence, how to manage our emotions instead of our emotions managing us. And that's a major part of what we teach as well. Well, in addition, besides death, depression can cause some pretty debilitating things that decrease your quality of life. It can cause a chronic headache, can cause osteoporosis. This is identical twin studies. Those that have depression have a 2 to 4% more bone mineral density loss per year than those who do not. When combined with stress, it increases the risk of HIV progressing to AIDS, increases the risk of return to addictive behavior such as drinking. And again, it underscores the need to treat it early. Increases the risk of developing asthma. It increases the chance that your offspring will suffer depression and physical medical problems. It increases the rate of decline in physical abilities with age. Whether you end up in a nursing home or not has more to do with your mental health than your physical health, actually, as you age. It increases stress hormones. That's not a good thing. It decreases sex hormones. That may or may not be a good thing, depending upon the individual. And it also impairs the immune system, and on top of that, it decreases the memory, particularly the area and the side of the brain called the hippocampus, which is there in the temporal lobe. It will decrease the circulation activity and the size of the hippocampus, and so it can have rather profound effects many times on memory. Fortunately, most of those effects are reversible, so when the depression clears up, the memory will also significantly improve. We've had individuals who are erroneously diagnosed with Alzheimer's disease because their memory was really starting to fail and they were aging, and so everyone just assumed that's what it was. but we found out it was major depression, and when we put them on the treatment program, their Alzheimer's, quotes, went away. Well, I don't think it really was Alzheimer's to begin with, because Alzheimer's doesn't clear up normally that readily. It was really major depression, and once we treated that, then there was no need for the Alzheimer's meds. Well, major depression is just a constellation of symptoms. The diagnosis does not give any indication of the cause of the disease. If we want to increase the likelihood of a long-term solution, we'll identify the cause of depression and systematically treat them, and unfortunately, this is not as simple a process as prescribing a drug. The most effective treatments will be based on an all-fronts attack on as many causes identified to be operative. Well, here are the 10 hit categories, we call them. These are the 10 causes of major depression. And again, one cause in and of itself is not enough. This is something that a lot of people are confused about as cause number one. They'll come into my office and they'll tell me, "Doctor, my father was depressed, my mother was depressed, my sister's depressed, and of course I have it too, and it's because I have a genetic problem, a chemical imbalance that I was born with, and thus I will need to take these drugs for the rest of my life." Well, they may have a genetic flaw, but interestingly, the genetic flaw in and of itself does not cause depression. You have to have other causes on board before you get it. And so it's important to recognize that you have it, but genetics in and of itself does not explain this disease. Developmental. This has to do with the way we're raised. We'll talk a little bit about that. Lifestyle hits, circadian rhythm hits. We'll get into each one of these in a little more detail. Addiction hits, nutrition hits. This is probably one of the most overlooked causes of depression, and that is what people are eating. What you eat does get turned into neurotransmitters in your brain. It is vitally important, and I've met many depressed individuals who have been in psychiatric institutions, who've been in and out of many physicians' offices, and they'll tell me that I am the first person who asks them what they're eating. It's just often not done. Toxic hits. Eighth hit, social hits or complicated stress or grief. And by the way, it's important to recognize whether it's a social hit or a social complication. And many psychologists have gone wrong in this area. People with depression tend to seek isolation. And the isolation in and of itself tends to lead to more depression. But which came first? And this is what we try to uncover in regards to this. Sometimes the person who has been seeking isolation in the counseling session is turned against their parents, their siblings, the very ones who are there who could help them out. And so the depression ends up getting worse. And so we need to really determine whether it's a cause or a complication and treat it accordingly. Medical condition, only 15% of people with depression will have a medical condition that is contributing to it, but it is important to try to rule that out, such as a thyroid problem or another type of problem such as lupus. And then frontal lobe hits. This is also a very overlooked category of major depression. And this has just been uncovered in the last decade. It's now well established that one of the main characteristics of virtually all depressed individuals, no matter what the underlying cause, is a significant decrease in the frontal lobe's blood flow and activity. Now, for years, psychiatrists and psychologists focused in on the emotional areas of the brain, what we call the limbic system. And they thought this was a problem with the emotional areas of the brain. It actually isn't near as much of a problem here as it is the frontal lobe of the brain. And this is a PET scan. We found this out through PET scans. PET scans are like Doppler weather. The hotter the color, the more activity. And this is a cross-section of the human brain on the PET scan. So this is the front portion of the brain. This is the back portion of the brain. And here are the side portions of the brain, which traditionally have been thought to be the emotional areas and limbic system, the side portions there. As you can see, the brain and its gray matter activity is down significantly compared to this one here, but the biggest before and after difference is right here in the frontal lobe of the brain. This is actually the same individual once they recovered from depression, and you can see this dramatic difference in the frontal lobe's blood flow and circulation. What comes first? Drevitz presents compelling evidence that frontal lobe problems are the cause and the effects are the depressive symptoms. And so we get into that. I show this picture because my kids brought this up after they had heard me lecture and say, notice even when the dog's frontal lobe is pressed in, he gets depressed.